we're here today with an ACMC doctor, Dr. Catherine Bishop. I want to welcome you to AM Live today. Is this your first time ever on the show?
Yes.
Well, it's good to have you today. And again, viewers, while we're watching and talking, feel free to call in if you have questions or comments or thoughts. 593-7181 is the number to call us. Doctor, why don't you tell me a little bit about yourself, who you are, what is it you do, what's your practice, and we'll go from there.
My name is Dr. Kathy Bishop. I am originally from Wheeling, West Virginia.
Really?
Ended up going from being a teacher and college professor to medical school. Trained in Danville, Pennsylvania. Ended up in Chillicothe, Ohio, where I've been practicing for the last 17 years, doing family medicine from womb to tomb. And then in 2006, due to circumstances in my own family with my mom having Alzheimer's disease, I wanted to do more geriatrics. So the hospital that I worked with at that time was Adena Regional Medical Center in Chillicothe, and we got together and started a geriatric center.
Really? Well, I want to back you up a little bit before we go on, because you sparked something in me a little bit. You said you were a teacher, and I was high school, college, was it? You
High
said?
school and college.
Okay, and college. And I was a teacher in middle school for a number of years, but the reason I'm asking is I got out, not because I wanted to necessarily, but after 15 years I got into another career. What prompted you towards medicine instead? You were teaching already, so how did you get to the medicine part from doing school teaching?
Always, being a doctor was something I always wanted to do.
Oh, really?
Ever since I was a child. But I think being a teacher taught me that I wanted to do more. And then when they were telling me more and more how to be a teacher, I thought, oh, I'm going to get out of teaching.
I think I know what you mean.
And then went into medicine, and now they're just telling us how to do medicine. So jumping from one
You're trying to be political about all that. I understand what you mean, but I do understand.
It was always something I always wanted to do.
Really?
So when I was 30 years old, I decided to go back.
Wow. Now, did you find that, was it more difficult at all? Or you're probably a studier when you're a teacher anyway, so.
Medical school was actually pretty easy for me because I already had the degree with anatomy.
Okay, right.
And so my first semester actually was pretty easy, except for biochemistry.
Okay.
Which I never liked.
All right. So you got into medicine now, and you've been in Chillicothe here and family.
I practiced in Chillicothe for 17 years and came up to Ashtabula County for personal reasons.
Okay.
And my last job in Chillicothe was as a medical director in two large campuses where they had long-term care, assisted living, and independent living for geriatrics, and I kind of fell into the geriatric mode back in 2006, like I was saying.
Okay.
And just really, really enjoy working with that population of people.
That's great. And I mean, I understand what you mean too about working with those people. Some people sort of fear, I'm not sure fear is the right word, but older people, it's like, I'm not sure what to say to them, or I think there's a lot can be gleaned from our older generation, and because like one time when Memorial Day is coming up, and I know a number of the years on Pat's show they've had local residents that have been in the military, maybe older guys from World War I or II, if they're still alive, and you interview, and you just hear what they have to say. Good grief, that's an older. No, they had the same hopes, fears, dreams, lifestyles that we all want to have now in our lives growing up to that point. You kind of just forget they were regular people too 20, 30 years ago,
I think the misconception that most people have of geriatrics is that they're old people that are just not able to do anything for us anymore.
Or sometimes crabby old people.
Right. And I can tell you and anybody watching that I'm going to be probably one of those crabby old people.
Well, aren't we all?
Most people are not. The majority of the geriatric patients I've taken care of over the years are very high functioning. 10% of geriatric people are in nursing homes. And, we need to utilize the knowledge that that population has. I have learned more about what really history is from my geriatric patients more than I ever have from any textbooks. From a textbook.
I think that's true. I agree with you.
And the interesting thing, I have to tell you this one story about a gentleman that I took care of in Chillicothe who worked on the atomic bomb.
Really?
And he was a physicist, and the most interesting thing that I learned from him is that he had no idea what that was going to do, and he was 90 years old when I was talking to him. But he says, we never really realized. So just those little pieces of history that you can get from.
Well, think about it.
folks.
Like watching TV shows or movies today, atomic bombs going off. You kind of you take it for granted the science behind it, and you're developing something that is devastating in a way. I mean, if you think about it, but the brains that it took to get to that point or develop those things, there's a lot. I think you're right. A lot can be gleaned.
Well,
more than a book. You're right.
We're all going to be there one day.
Right.
And,
I think I agree there.
We're at that point where probably about a quarter of our population in the next 10 years is going to be older than 65.
Well, are we more or less history-wise living longer than you used to live? So of course we're around
and there's
more.
There's a lot of reason behind that, not just medications.
Okay.
I mean, I think people are living a little healthier lifestyles as they get older. Our generation's not. But the older generation, there's more activities for them. There's more opportunities for them to be involved in the community. And I think we're getting there with the geriatric population. And that's one of the things that I like to really use with my practice, is to keep people active. One of the biggest aspect of my practice is to I do a lot of what's called Continuum of Care.
Okay.
So we start, folks who can come into the office. My office is in Jefferson.
I was going to say, well, you say you're up here now. Would you tell it where you're located?
Yeah, my office is in Jefferson. I'm there 3 afternoons a week because the majority of my work is in long-term care and in house calls.
So you're actually going to visit the people where they are many times instead. But you have office hours that some can get into you. So you're in Jefferson.
I'm in Jefferson.
Excuse me. Go ahead.
And so you look at the continuum of care of any population. You start with things that are in the office, in a private office, for people who actually can get in to see the doctor there, or see a nurse practitioner or a PA, whomever your primary care person is. And what happens is, as people age and they get more medical problems, it becomes more and more difficult for them to get into an office.
Okay.
So we have to have some kind of venue for them to be able to receive adequate care.
Okay.
And not just adequate care, but good care.
Now, do you feel we'll talk our area because we're up here in Ashtabula County or whatever. Is that available quite a bit up here? Do you find it lacking, or what do you feel about geriatric care in our area in general?
From what I'm understanding, I've only been working with ACMC since November.
Okay.
What I do with house calls is very limited for folks. There is a couple of agencies that will provide physicians to go into the home. But what I want to do is provide more of a continuity of care.
Okay.
So I can take care of a person from being in the office to they transition when they can't get in the office anymore.
Okay.
And then I can do a house call on them because they are now homebound.
Okay.
So they have to, it takes them a walker or a wheelchair to get out, or they have to.
Is that kind of rare today, the house call part of things?
It is pretty
Does that
rare,
happen
but
much anymore?
it's coming back around, I think.
Like by necessity, or what do you think?
I think for two reasons. Number one, necessity, and they have found that it actually prevents more hospitalizations.
Okay.
So by taking care of a patient in the home when they're sick, you can prevent them from having to go to the emergency room.
Well, sometimes you're sitting there getting maybe worse and worse and not treating something. Right. Then you end up going, when it's so bad, you got to go do something.
Well, then you go to an emergency room, and that's 100 times more than it would be if you go to a doctor's office.
Gotcha.
So, I think the Ashtabula County is a very large county, as you know, and I've learned every back road of Ashtabula County in the last few
years. You could be on the patrols with the sheriffs, right?
I'm telling you. I could call and tell them where they need where they need to clean the snow off.
There you go.
By the way, this winter was my welcome to Northeast.
Oh, that's true. You said November. I was going to say welcome welcome. You have been baptized.
I've been baptized to the snow and the ice. But the interesting thing about house calls is that you get a different perspective of how patients really truly live.
Okay.
When I see a person in the office, I'm seeing that little segment of their life for just 15, 20 minutes.
Okay.
And they can tell me anything that they want to tell me. But when I go into their home, I see the living arrangements, I see the barriers to good care, and that means simple things like their fall risk.
You may notice things, or
poor lighting, or they have throw rugs all over the place, and or they have high steps or clutter, so that's the initial thing that you see on a house call. The next thing you see is just the interaction of the family.
Well, I was going to ask you, what do you think, how do you see as the doctor that works with these people, this is not a guilt tripping anything, but do you find a lot of families helpful, or do you find a lot of older folks who need help and they're just we're too busy and they're not getting it? What do you find?
All of that.
Really?
I think the biggest thing that I noticed is that, the geriatric population now, a lot of them are still living alone.
Okay.
And
like as long as they can, kind of a thing?
As long as they can. And those folks really tend to do better overall because they've learned how to take care of themselves.
Okay.
So as a majority of the house calls I do, those people living alone generally do fairly well.
Okay.
People who have moved in with a daughter or a son or a family member, they're a little bit more debilitated already because they've had to move out of that independent living.
Well, it's kind of like this isn't my place anymore,
right.
sort of a thing, or what?
Well, no, they feel that, number one, it's not their home.
Yeah.
And then the second thing is that their family's trying to dictate to them what to do.
I've lived my life to this point on my own.
Yeah. And then the third thing is a space.
Oh.
People are going from a home that may have 5 or 6 rooms to having one small area in a house. So if you've ever tried to condense a house into a room with your belongings, that mean the life to you all your life,
right.
Pictures and antiques, and it's very difficult. So that transition is actually very hard for older folks to go through.
Just the sort of and they're still cognizant if they're losing that independence is kind of the thing.
Right. Yeah, the hardest thing I've ever had to tell a patient is not that they have cancer, but they can't drive anymore.
I was going to say, take those keys away.
Take
Probably
those keys
like, oh, what do you mean?
away.
I did this for years.
Yep, and it's very, very difficult. Very difficult. But
Wow.
But then the other thing about house calls that I really get a relationship with my patients, and that's what being a family doc is all about, is developing relationships. I tell my friends who are specialists that they see people just for whatever they see them for, and then they send them back. I said, I build relationships with my patients, and by doing that, they're more likely to listen to me when I know that when I do house calls and I say, you can't live at home anymore, because then we have to go to the next step, and that's either assisted living. Assisted living is where there's nursing staff available, and we do lack assisted living facilities in Ashtabula County.
Oh, really?
There's not a lot of them. There are some private ones that are available, and there are some that are Medicaid waiver that will get some folks in. So you transition to assisted living if possible.
Okay.
Because you still have nursing care, you still have aides that'll help you, and it's a supervised area, so it's generally it's very safe. Then when that piece is no longer acceptable for proper care, then they go into a long-term care facility.
Anything in the new changes and new laws that start up in 14 as a doctor, physician? I know a lot of patients have opinions, and we as citizens, good, bad, or ugly, have opinions, but how do you feel anything helped, enhanced, or hindered practices now, do you think, with all the new laws that are out there?
I think you have to look at the Affordable Care Act in various lights.
And I was thinking even maybe related to geriatrics even specifically.
And to do that, I have to start at a couple minutes before.
Sure.
The biggest thing that I have noticed with what people are calling Obamacare is the Affordable Care Act.
Right.
And about 1/3 of it is actually very good and beneficial to patients. The other 2/3 is very cumbersome, and it's very difficult to understand because it's so involved in not just limiting what health care benefits are available, but also with the mechanism on how to get those services. That's where the limiting thing is.
Okay.
But for geriatrics, the biggest thing I tell my patients to look at when you're looking at an insurance policy, if you are going beyond just having Medicare, you need to look at something that is going to cover what your disease processes are. So a person who is very, very healthy, and regardless of whether you're 40, 60, or 80, and you don't have a lot of medical problems, we tend to, as consumers, look for something that's not going to cost us a lot.
Right, okay.
So if you look at somebody who has just Medicare and they have Medicare benefits, the biggest effect that they're going to see with the Affordable Care Act is that their medications will probably cost a little bit more, and it'll be a little bit more difficult to get name brand medications.
All right.
It's going to be a little bit more difficult to get elective surgeries.
Okay.
So,
Such as, now when you
such
say
as
that, like what
a
is
knee
it?
Replacement, or
Okay.
a hip replacement.
As compared to
or
life-threatening things,
as
you
compared
mean, or
to
something?
life-threatening
Okay,
things like
all
get
right.
your gallbladder out.
Okay.
Have
Heart
something like that,
surgeries
heart
or
surgery.
something. Okay, gotcha.
Yeah, those things are not going to change. It's those surgeries or procedures that don't necessarily have to happen right now.
Okay.
So that may be a little bit more difficult. The other thing that may be a little bit more difficult is finding doctors who actually take these new insurances. And it's not because most doctors don't want to take them, it's just because of the limiting of who those are available to.
Okay.
For example, in our area, there's only, I believe, 2 or 3 different insurers who are covering Obamacare.
Okay.
So, and they're not all available to every doctor because those doctors are not on those insurance panels.
Ah, okay.
So it's not that I don't want to take that person's insurance, it's that the insurer does not have me as part of their panel.
That's interesting.
So
okay.
that's a little difficult part.
And do you see that being worked through over time, or do you think it's going to be a sticking point?
I
kind
think
of
it's
thing?
going to stay the same.
Oh, okay, okay.
And the other thing that really scares people, and I don't care how old you are, is when you have to change doctors. I practiced for 17 years in Chillicothe, and when I told my patients I was leaving, it was like I just shot them through their heart.
Well, they know you and you know
Well,
them.
we had relationships. I went to funerals and graduations and weddings. And so you have somebody who's in their 60s or 70s is now being told that they can't see their doctor they've seen for 20 years. And that's part of that Affordable Care Act, just because of where those insurers are placing their dollars.
Okay.
So the big thing I would tell people is, number one, if you have to change insurances, really get educated on what's available and who's covered. And the second thing is to look at your medications and see what medications are brand name rather than generic.
Okay.
Because the different insurers cover different things. So the one thing I want to dispel is that there's not a death list in Obamacare where they're not going to take care of seniors who need to be taken care of.
Okay. Well, yeah, we're getting kind of extreme there. I understand.
But one of the things that is in there is about making that declaration of a living will.
Okay.
And if I have a couple seconds to
Sure.
talk about that.
Yeah.
A living will in the state of Ohio is mandatory for doctors and clinicians to ask if you have a living will. And what a living will is something that states what your wishes would be if you weren't able to make decisions for yourself.
Okay.
So do you want to have a tube feed? Do you want to be kept on a ventilator? Do you want to have chest compressions or shock?
Well, these must have been some of the things we went through with I was talking off air. My father-in-law recently had those kind of decisions. Okay.
And part of the Affordable Care Act is saying, people really need to make that decision before it happens right then.
When you're thinking about
When
it,
you're
cognizant
thinking about
of it,
it,
and all
you're
that.
you're in fairly decent health, you have your
Well, let me ask you this.
quote unquote wits about you.
Does that not happen enough in your practice?
doesn't
That you just know it
happen
happens more toward the end than where it should
It
happen?
happens too
And then
late.
you can get fights, probably, and all sorts of things can go on.
It's awful. It's terrible for families. It's a very important thing to talk about what you want done at the end of your life.
But you have to do it, don't you?
You have to do it. I talk to all of my patients about end of life issues and the fact that you really need to talk about having a living will. And what that does is it gives you the power, because you make that decision and you pick the person that you want to.
Well, just to make sure that's straight, in that living will, then, if that's a document that you've had done, finished, and whatever it has to be legally binding, no one else can. That's not true. We're going to do this instead. It's going to. I mean, does that work?
Well, that's a slippery
unless there's a
slope.
power of attorney or something like that.
It's a slippery slope, because I've had children come in at the last minute when their parents
Try to
are
argue that
try
or
to
something.
argue it. Yeah.
But normally it kind of sets for
Normally
what
it sets
you want.
the expectations.
Okay.
And then the last thing about the Affordable Care Act, there are some stipulations in there that in the Medicare rates are going to be going up
Okay.
So deductibles are going to be going up, so that's going to directly affect seniors in a lot of ways. And like I said, I've been doing this for a long time, and the saddest thing I see is a patient making a decision to buy food or to buy their medicines.
And now you literally have seen. I mean, you hear that, but
absolutely.
you've seen that going on.
Yeah.
It's just that close to the dollars per month.
Right. So just a little bit of an increase in those
We'll
premiums
change some of that.
is going to make a big difference.
Okay.
So those are things that most seniors can look at. What's going to be another, if you buy a supplement to Medicare,
Right.
that's where that Affordable Care Act is going to come into play more, because that's where you have to really look at your medications, and you really have to look at, what specialist that you want to see and your family doctor you want to keep, because those supplemental things, like I don't want to mention any names,
Okay,
but there's supplemental Medicare Advantage programs.
Okay.
Those are the ones you really have to be careful on, because those are the ones that the insurers have started to dictate things like Obamacare wanted, like the Affordable Care Act.
Okay. Wow. Well, that's
Okay,
amazing.
answer
I
your
think
question.
no. Yeah, and I think look, it's like you said. Everybody, we were going to come to those points in our lives, and I think one thing you glean right off the bat. Rarely our last minute decision is going to be the good ones, because you're in a crunch then. And emotions come in and all that other stuff. When you can think clearly and help your family, it's not a fun discussion, I'm sure. But you know what? If you love each other, again, we're not talking the extreme families. The people that I think most people would want the best for their elderly parents or if they're normal people. But to wait to not talk about those things,
it's hard.
It's not fun, but you got to do it.
It's hard to give up your parents.
Well,
it's hard, and I can tell you just from personal experience. My mom passed away from complications of Alzheimer's. And I remember her telling me, when she was still pretty coherent, that if I put a tube in her or shocked her heart, she was coming back to haunt me. And she meant it. She wasn't just kidding. So my brothers and sisters, we were all on the same page, and we knew that. One of the most difficult...
Doesn't make it easy, but at least you knew what her thoughts were.
I knew exactly what her thoughts was.
Yeah.
But one of the most difficult times I've ever had, when I used to do more critical care medicine back when I was younger, is to sit in an ICU with a patient who is at the end of their life and have 3 or 4 kids fighting about it. It's not good for anybody, and it's very important to really sit down with a family and come up with a plan on.
I'll agree with you on that. I mean, it is hard, but you know what? I can remember my mom passed a few years back. My dad's still alive. My mom passed a few years back, and I can remember other people. I won't say everything about it because it's personal stuff, but she just didn't want a lot of services or any of that kind of thing. Not everybody else outside understands it. My sister and I kind of stood firm and said, look, I don't mean you guys are going to be happy, but Mom wanted this, and since we knew that, we could honor her request. I'm not even sure we didn't want some of that stuff.
Sure.
But she said, Jim and Jen, when it's time, this is what I'd like to have happen. And fortunately, we knew that. She got her wishes, is what I want to say. And I mean, that you can do that for somebody, if that's really, and they're like in their right mind, they're making those decisions. If you can do that for somebody, it's their life. You got to give them the choice if you can.
I tell my patients what my dad told us as children. I'm the youngest of 8. My dad used to tell us, I don't have to make any of you happy, but I can make you all equally unhappy. So that's why I tell my patients, I say, you're not going to make everybody happy, so make them equally unhappy, and everybody will be fine.
Well, good. We're out of your great things to talk about. They're not always fun and pleasant and jokey, but that's great, Doctor. 593-718. Would love to hear from you listeners while we're here with Dr. Catherine Bishop. Let's get on to I have a couple things on here we haven't covered. I know you want to talk about a little bit. I know you said you're located in Jefferson. I have a question. What are some changes coming to the Jefferson office?
The Jefferson office is on North Chestnut Street, right in the heart of the town. And right now there are 3 doctors, Dr. Singretti, Dr. Parker, and Dr. Andy there, and I'm there part-time. And we're getting a 5th doctor, Dr. Nathan Franley, who is from Jefferson.
Oh, okay.
And he starts next year. He's just coming part-time right now. But the exciting thing is that they're expanding that building. It's going to probably double in size.
Really?
Over the next few months. We're going to offer full radiology services, lab services, and physical therapy there.
Right there that's
in
interesting.
So that's.
I take some of the care that ACMC is trying to do is I mean, there's probably things you always have to go to the big city for, but
Right.
if you can do some more things locally in our county is the idea.
Well, and the biggest thing is not, it boosts the economy
Sure.
by we'll have more people to work there, but it also just increases the access to care. One of the most difficult
And you'd say some of
things-
that's lacking maybe in our area?
It is, yeah. It's hard to get around in some parts of Ashtabula County, but there's a large population of people who live in Jefferson
Okay.
and in that area that would love to go there and have their blood work and their physical therapy and their X-rays, and it will really, I think, make a boost not only just for Jefferson but for the practice itself.
So that's coming, I mean, they're building on it now, and it's
I
so up
think
to 5 doctors will be in there then
up to
total?
5 doctors will be there.
Great. We did some continuing care. Let's see. Where do you see your practice going with the elderly? What are some things you can tell? I'm in my 50s. I still have a mother-in-law that's alive, a dad that's alive. No grandparents for me anymore at this point. Like I said, my father-in-law and mom are both gone. What can I do? And there's probably a lot of our viewers are in my age range. You know, this area's got a little bit of an elderly population to it. Probably some that watch our show would be in that range too, some of them. What can we do to just be better family members, kids to our parents? What can we do to help better prepare with all the things you've seen in your practices over the years? Without interfering, what can we do to be helpful?
You mean to, like, for parents?
Well, even just
Yes.
health-wise, and what can we do to be helpful?
The most important thing that we can all do for ourselves is to live a healthier lifestyle. Now, what does that mean? If you look at one magazine article, it's going to mean something else. It's going to. I mean,
How do you see this?
well, the bottom line is decreasing the amount of fat, cholesterol, and carbohydrates in your diet.
Okay.
So less breads, less cereals, less fat. Exercising 15 minutes 3 times a week. And even a person in a wheelchair can exercise. Majority of them have upper body strength. They can do range of motion.
Okay.
Do range of motion with the legs. They have done studies that show that if you want to lose weight, what you do is you eat less and you exercise more.
Really?
That's,
That's got to be new.
it's a new thing. It's a new thing. Nobody else knows about it.
Exercise
So
more.
you don't need a lot of.
You're a practical doctor.
Hey, you don't need a lot of pills to do that. You don't need a lot of herbal medications to do that. You don't need a lot of equipment to do that. The healthiest exercise to do is walk. It
I was
keeps
going
your
to say,
bones strong.
if you're able to physically get out that walking,
That's the
you
walking.
you
is
just
the
feel
best.
good. I took with a Sunday. We were at Mom's house for dinner and stuff after church and this and that. And the son and I, little guy, and I went across the street to walk around the cemetery. But after a meal, that's probably a really good thing to do. And to get in
Absolutely.
practice of that with the kids and growing up, and even yourself in your older age, you got to keep, because things get stagnant if you don't use
Sure
them.
they do. I remember when I turned 50, the first thing I woke up with was a backache.
How did my back
What is
start
this
hurting?
going on? But if you walk before you eat, you don't eat as much.
Is that true? Really?
Yep.
Just certain enzymes or something going on
Just-
while you're
yeah.
walking, and really, I know I've heard
Keeps
it's
your
good either
endorphins
way.
in and
But the key
there
is
you
to
go.
walk and do something.
to walk and do
So
something.
keep ourselves a little bit healthier of a lifestyle, like you call it, eating right and
so
exercising.
diet and exercise. The
Okay.
other thing is, as we get older, you look around your house for safety issues.
All right, give me what are some quick clues
First
on
of
that?
all,
I've heard you say throw rugs.
Get
and
rid of
stuff.
all throw rugs.
Just too much of a slip factor.
Too much of a slip factor, trip factor. Get better lighting in the house.
Like meaning just they're usually too dim, or what do you mean?
Most people like mood lighting, so it's lighter.
Okay.
Well, that kind of darkens little corners of the house or
Oh.
darkens area where you don't see there's a toy or there's a
Oh, okay.
book or something laying on the floor and you trip over it. So better lighting. The other thing is to do something for yourself every day.
Really?
I mean, it sounds very simple, but most of us go to work, we work all day long, we go home, we eat dinner, we sit and watch TV, we go to bed. We need to have some kind of hobby or some kind of an outlet to really enjoy our friends, our families, or whatever we want to do. And people who have outside activities outside of work actually are happier.
Well, let me ask you this. That brings me to a thought, and we'll kind of get near closing here, but I was thinking, what you've seen many folks in their home, as you say, and older folks, you hear about retirement, or you can't wait for it, and that's really, it's not a bad goal, of course it's good, but is retirement in your mind as a physician and working with older folks especially, sitting in a rocking chair, and in other words, you start to slowly just go down, because the work day's done for you then, if you need to be active after work if you can. I mean, unless you're physically unable, but...
Well, one of the things I tell all of my patients when they're getting ready to retire,
Right.
I don't tell them, I ask them, what's your retirement plans? Are you going to go and sit in a chair? Because if you do that, your health actually goes down.
Well, you've changed your... Think of your day-to-day routine of even just getting up and getting ready for the day every day, and then 8-9 hours, and it's different.
Well, if people don't have a plan on retirement, they get depression more.
Okay.
Because they've now gone from being a quote-unquote productive person to being somebody who don't know what to do with themselves.
Okay.
So, have a plan on what kind of hobbies you want to do, if you want to do travel. Most of the people that I know that retire are doing some kind of volunteer work.
And there's time for that now.
Yeah, there's time for all of that. And a lot of my patients will tell me they're busier now than when they worked.
Well, it's funny.
Which
I
is
mean,
great,
before
because
the
that's what
father-in-law
you
had
wanna
all
see.
sorts of health complications. When they retired, I don't know how I had ever had time to work. I mean, because then you get into doing so many things. Now, then, of course, some of it is you go from, you hear the funny side, doctor to doctor, there's your day. But anyway, how did I ever have time to work? It's like, staying active is important. And mentally, I think, and physically.
Now, when I was in Chillicothe, we had a lot of elder programs. We had like adopted grandparent programs in the schools where they would go and help children learn to read.
I think that's awesome.
And
but that interaction, I think, of the older and the younger is such a great, for the kid even, too.
And the other thing that helps older people is to go into nursing homes to volunteer because they see it's not a place to die.
Like what you might think it is.
Well, it used to be like that. I know when I started practicing 20 years ago, that's what it was. We sent people to a nursing home. Well, they're long-term care facilities. People are living for a long time. And people who are able to come in and perhaps sit and read with a patient who can't see anymore, or just to visit with a patient who doesn't have any family members. So there's a lot of things to do in the plan for retirement, but that's the most important thing is to make a plan.
That's great. Okay, Doctor, I thank you so much for being here today.
Hope
you'll be back to talk to Pat many times down the road. Folks, Dr. Catherine Bishop, let me ask you this. Are you accepting people, or do you want to give a phone number out or anything to contact you or office?
I am accepting patients. Our number is 440-576-8933.
Tell you what I'll do. Give me that one more time, please.
440-576-8933.
In case we get calls after the fact, we'll have your number. And that contacts you were the office where you would be locally here in Jefferson.
Yep.
Great. Glad to have you today. Thank you so much for your time, and we'll hope to have you back.